Hello, my name is Rachel Wright. I'm the Tube Feeding Coordinator in the Southern Trust. This video is to show you how to unblock your feeding tube. It is suitable for patients with nasojejunal tubes, all gastrostomy tubes, and jejunal tubes. If you have a nasogastric tube, you may only administer an air flush unless you have confirmed position in the stomach by obtaining a pH of 5.5 or below. For the purpose of this video, I am using a gastrostomy tube. If you're feeling resistance in your tube or it is blocked, you can try an air flush or a water flush. By using an air flush, take a 60ml syringe and fill it with approximately 10 or 20 ml of air and administer it down your tube using a pumping technique. If you have a smaller syringe available, such as a 10 or 20 ml, you may wish to use this type of syringe using the same technique. The smaller syringes give greater pressure, however be cautious using these with 8 to 10 French tubes as they could rupture the tube if pressed hard on the plunger. A water flush may be administered, again approximately 20 ml, using a pumping technique or indeed a push-pull technique to try and move the blockage. You should also try to massage the tube between your thumb and forefinger along the length of the visible tube. If none of these steps work, you will need to use a declogging agent such as clog zapper. Clog zappers come in a pack with a powder in a syringe and also a wire applicator. Always check that your clog zapper is in date at the bottom. And you always need to be sure what type of tube it is you're administering the clog zapper to. If you have a gastrostomy tube, you will see along the length of the tube there is a little black dot. At the black dot, if you're using a gastrostomy tube, the applicator needs to be cut here. If you have a nasogastric, nasojejunal, peg tube or jejunal tube, the applicator does not need to be cut. You then need to insert the applicator down through the centre of the tube until it is fully in, and then you're ready to mix the solution of the clog zapper. So in your clog zapper syringe, you will see markings on the back, and I want to make up this syringe with 10 ml, bring it up to the 10 ml line with water. So take your cap off, insert into some sterile or cool boiled water and draw up to 10 ml. Once you have drawn up your solution, you will need to put your cap on and vigorously shake the syringe until the solution is completely clear or dissolved. This may take 1 to 2 minutes. Once you can see the powder has dissolved in your syringe, take your cap off and insert into your applicator. Administer half the solution into your tube, take the syringe off, put your cap back on and remove the applicator. Place your cap onto your tube and let the tube sit for 1 hour, after which administer a 60 ml water flush. If the tube is still blocked, repeat the steps again by inserting your wire and inserting the remainder of your clog zapper mixture. If the tube remains blocked, it should be replaced. And once your clog zapper mixture has been mixed with water, it can be stored in the fridge but must be disposed of after 24 hours. I hope this video has helped you unblock your feeding tube.